I'm Linda Todd, and I'm the director of Hospice of Siouxland. Each one of us is going to face our end of life at some point in time. The beauty of hospice care is it's really designed to meet those needs. If it's physical needs, then we have a very skilled staff of physician, nurses, in conjunction with their primary physician. From an emotional perspective, our role is to help people live, to have quality of life, to make the best of those days in whatever way we can.
My experience with hospice has been nothing but a positive thing for my husband and I both.
Well, my dad was on hospice already, and in December my mom got really sick, and she was bedbound. We thought we were going to lose her.
I was pretty bad shape, and I couldn't eat, I couldn't hold food down. I really didn't think I was going to make it myself.
And so Leanne was our hospice nurse with my dad, so I called Leanne. And so then Leanne came out the very next day and determined that my mom was being over-medicated. She had lost 60 pounds taking care of my dad. And so then they adjusted her medication, and she started to rebound, and she's with us today because of hospice.
Our staff, many of them have been here 15, 20 years, so there's years of experience and expertise.
I'm Dr. Dale Holdeman, and I came to Hospice of Siouxland in November of 2010. I think the 30-some years that I was in practice gave me a lot of experience and knowledge, and what I discovered after I came to hospice was their ability to handle other problems. So many times there are issues within the family that need to be dealt with so that the end-of-life process will be much easier for the patient and the family, and the team is incredibly adept at working out those problems.
I'm a hospice RN. I've been working with Hospice of Siouxland for 25 years. My focus as a nurse is to ask the patient what today is troubling you that you want help with.
The hospice nurses come and visit me once a week. They take all my vital signs, and that's how she keeps up on what's going on. And they could pick up on things that I wouldn't even think of and take care of me with.
And just little simple things that you don't think about. Hospice just knows those tricks, and it works really well.
Relief for the caregivers is huge. They're trying to care for their loved one. They may have other family responsibilities. They may be working outside the home. Just gets to be too much sometimes.
They have immensely lessened my stress level. If I have a concern, I don't have to second guess. I just pick up the phone and call hospice.
You can feel it from the first week you're in the home that they lose the notion that this is end-of-life care and realize that probably what is going to take place here is they're going to have the best day they can have. It happens in many cases that they survive longer than the time that they were probably given when they came to hospice.
There's 10% of the people that we serve are discharged from the hospice because they've improved from the hospice services.
It's just refreshing to know now that she's starting to gain weight and she's starting to do things that she loved to do.
Well, I'm 92 years old, and I'm getting along fine. I've been able to go to church for the last 2 months, and that's a big plus.
I have a strong commitment to hospice and palliative care because I believe every individual has the right to comfort and quality of life. And I don't always see that happening. I see people suffering unnecessarily.
You basically put your lives in their hands, and you know they've gone through this before, and they can give you great advice, and it's a little scary for you as an individual, but for them, they are so comforting to have around. They're just so comforting.
Well, hospice really gave me my life back. I was ready to go. I mean, and I thought I was going to be going, and gradually it came. You know, they worked with me and gave me my life back.
I think we need to understand what resources are out there. I think that when we need help with ourselves or with our loved one, we should be aware of those services before there's a crisis, and that we should ask for assistance. There is no need for somebody to not have the support they need when they're in the last months of their life. If your goals are comfort and quality of life, then call hospice and allow us the opportunity to help you and your family.